If you suffer from plantar fasciitis and you've tried typical treatments like rolling your foot on a frozen water bottle or stretching your calves and it hasn't worked, you may start to wonder if the pain will ever go away or if it's something you'll have to deal with for the rest of your life. But the good news is there are some simple self-massage techniques that you can do at home that help relieve the pain fast. I'll share 3 of those in this video. Plus, if you stay to the end, I'll share some exercises to help make the relief last longer and keep it from coming back in the future. So let's get started. Now, when you massage for plantar fasciitis, you're not actually really massaging the plantar fascia itself. In fact, most cases of plantar fasciitis have to do with some other problem, either muscle problems in the foot or calves, or in some cases, nerve problems. So the goal of these massage techniques is actually to massage muscles that refer pain into the foot arch or into the heel. The first one is a muscle that runs along the bottom of your foot. You have 4 layers of intrinsic muscles in your foot, and one that refers pain to the heel is called the Quadratus plantae. It runs like this. It has 2 muscle bellies. And if you just kind of stroke along that area, you may find some areas that are sore or tender. If you do happen to find a sore or tender area in there, take your fingers and kind of localize to where you find the most sorest, most tender area. The muscle fibers run in this direction down towards your heel. So to find that, you're going to massage perpendicular across the muscle fibers. And if you happen to feel a sore or tender knot, just stay there and hold a gentle pressure on it. It does often help to flex your toes or bend your foot a little bit. That helps put these muscles on slack. And when the muscles are on slack, they're more likely to relax than when they're on tension like this. So put the muscle on a little bit of slack, find the sore, tender area, and just apply a gentle pressure. Now you have to be a little bit patient because it takes 1.5 to 3 minutes to get a trigger point to release. So just hold the pressure there. As you hold the pressure, you may notice that you can sink in a little bit deeper without causing more pain. And do that over the course of a few minutes, and then we'll move on to the next technique. The next muscle that can refer pain into your foot arch is your gastrocnemius, and particularly the middle part of your gastrocnemius. The gastrocnemius is one of your calf muscles. It's the more superficial of the 2 calf muscles, and it crosses your knee. To find the part of the gastrocnemius that refers pain down into the foot arch, you'll pinch the inner part of your calves with your fingers, and most people are at least a little bit sore or tender in this area. Again, the muscle fibers run down vertically on your legs. You're going to kind of strum with your fingers pinching across like this in a perpendicular direction to the muscle fibers. And when you find a sore or tender area, just hold a little bit of pressure on there. It is possible in this area that you may find more than one spot. So when you find that trigger point, just hold pressure there, again, 1.5 to 3 minutes. It does help to have your toes slightly pointed like this. You don't want to pull them up on stretch because that puts the muscle on more tension. You also don't want to actively point your toes down. So just let your foot kind of fall in an easy plantar flex position and then just hold the pressure on that trigger point or not. And the final place that we'll look at is the soleus. The soleus is the deeper of your 2 calf muscles, and it doesn't cross the knee. There's a trigger point in your soleus right above your Achilles tendon here, and that refers pain down into your heel, where many people feel plantar fascia pain. And so squeeze along the Achilles tendon until you find a sore or tender area. Now you may have to squeeze on both sides of the tendon, so kind of pinch on either side of the calf, and you may have to get pretty deep in there. If you can't pinch with your index finger and thumb, you can also put your foot up on something and press from both sides with your index and middle finger and try to pinch that trigger point between your fingers there. Then once you've found that knot or that trigger point, hold the pressure on there, again, 1.5 to 3 minutes, and work your way up and down the soleus. Oftentimes there are several different trigger points in the soleus that may be stiff. Now, if you have trouble with your hands or fingers, for example, from arthritis, and you can't pinch or hold pressure with your fingers, you can also use a massage gun to help treat these same areas. However, I would use a smaller trigger point attachment like this, or even the little fork attachment that's meant to go around your spine and treat muscles on either side of your spine. Both of these have a smaller head, which you can get more isolated to the trigger point. Just the normal rubber ball attachment like this is probably a little bit too big to be as specific as you'd like, particularly for the deeper muscles in the bottom of the foot and the soleus. So I'll show this first with the trigger point attachment. It's just about the size of your thumb. By the way, this is the Bob & Brad X6 Pro Max. I do really like this massage gun. This isn't a sponsored video. This is just one that I really do like. So you'll take this and turn it on, probably on the lowest setting for this. So you don't want to use it on an extremely high setting. And then kind of find the spot in the bottom of your foot. Just apply very gentle pressure. And then once you find the spot, just increase the pressure to a comfortable level. You do not need to get incredibly deep with this. Just hold a gentle pressure, and again, hold there for a little while. It may not need to be quite as long as 1.5 to 3 minutes because this does vibrate rather quickly, much quicker than you can do with your hands. So that's the Quadratus plantae. For the gastrocnemius, find the spot on the inner part of the calf there. You'll have to kind of pin it down against your shin bone and then just hold pressure like that. And then finally for the soleus, you want to make sure you're not getting the massage gun on your tibia or shin bone. And so start from the back part of the calf and start to work forward, work down towards the Achilles tendon, just behind the shin bone. And then when you find a sore or tender area, just hold the pressure right there. Now, if this is a little bit too thick for you, again, you can use this fork attachment, but you're not going to be using both points. You're just going to focus on one point or the other. Work it down behind your tibia here. And again, try to find a trigger point in your soleus that feels sore or tender, and then hold the pressure right there. After you've released the trigger points, now you want to exercise those same muscles to help prevent the trigger points from coming back. The Quadratus plantae is an accessory toe flexor, and so we're going to do an exercise that involves flexing the toes and doming the arch. To do this, you just slightly scrunch your toes. Think about pulling the ball of your toe back towards the heel like that. You can do this either in a non-weight bearing position, or a more functional version is kind of gripping the floor with your toes. Ideally, you want to do this as you're standing and walking. That helps to maintain your arch height. So once you can do that comfortably in a seated position where you're just gripping the ground with your toes, maintaining the arch height, then progress up to doing that in a standing position, and then eventually standing and balancing on one leg while still maintaining your arch height. Next, we'll move on to stretching your calves. And these may look somewhat similar to calf stretches that you've tried in the past, but when you have knots or trigger points in your calf muscles and you go to stretch them, the parts of the muscles that already stretch well will stretch while the knotted areas stay knotted. So now that you've gained that new flexibility, it's time to take advantage of that. First, we'll do a stretch for the deeper calf muscle, the soleus. To do that, dome your arch, much like the last exercise, and then go into a partial lunge where your knee goes ahead of your toe. Make sure to keep your heel on the floor. Now, this stretches the soleus, but because the gastrocnemius crosses the knee, we'll need to do a different exercise for the gastrocnemius. So hold about a minute on that first stretch, then you'll put the leg that you're stretching behind Still keep your arch domed and lean forward with your knee straight. That'll stretch the more superficial of the two calf muscles, and again, hold this for about a minute. So those were the massage techniques plus some exercises to help relieve plantar fascia pain. If you'd like more tips to relieve plantar fasciitis, check out this playlist over here. But before you go, if you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.